So low-level LED light therapy has been used extensively in the past 10 years probably. First discovered in relation to photodynamic therapy, but as time went on we've discovered it's been very useful for other dermatological conditions. We use our light therapy back to back here. It's going all the time, and the majority of the patients who get maximum benefits are the acne patients. So a combination of blue and red low-level light therapy twice a week, done for a period of about 4 to 6 weeks, is a good adjunctive treatment in relation to acne. Also in combination with antibiotics and the other topical retinoids that we'd use for an acne patient. And most of our moderate acne patients actually improve in that 6-week period and get to the point where they can come off their oral antibiotics a lot earlier than they would be if they were being treated with that alone. And fortunately, not many of our patients end up with Roaccutane as a result of that if we get onto them with the phototherapy early enough. It has also been used for psoriasis, for eczema. We use a lot of it for our post-operative wound healing, and the yellow light therapy, which is slightly deeper therapy, is used in that indication. And we're seeing excellent results. So it's wonderful to think you've got an aesthetic treatment that doesn't involve drugs, that is completely harmless to the patient. It's low cost and treats all these other dermatological conditions as well.